The ideal fellow for our program is someone who's really inquisitive, who likes hard work and likes a challenge, and who really has a very good emotional IQ when it comes to taking care of patients with long-term chronic diseases, because that's ultimately what we do day in and day out. And so you have to have a passion and a love for long-term relationships with patients and families. You have to have a passion for solving a puzzle, because that's often one of the more integral things that we do. And you often have to have somebody who's very empathetic. And so those are the qualities that I think are most important for our fellows walking in the door.
The first year of the Pediatric Rheumatology Fellowship is very clinic-oriented, which I think is very beneficial, so that you can get the opportunity to try to see as much as you can while you're being supervised by attending, so that you do have that experience and, again, that kind of solid foundation for when you eventually graduate the program. So the fellow is really, in that first year, kind of the lead, and the attending is there for more kind of supervision and, of course, to teach them. We really try to give our fellows, I think, a little bit more independence so that they can feel confident. In the first year, we have what's called a fellows clinic, and so our program, the fellows have their own clinic, meaning that patients, when you get that call, you're going to see Dr. So-and-so, they're going to see the fellow and not be assigned to the attending. And I think that that's a big benefit to the fellow, because it gives them the sense that this is my patient, and they can build their own patient population with that. And so I think that's something that we do differently in our program that is a nice benefit. And then you also do some elective time. So a lot of our patients may need other specialists, and so we have our fellows kind of rotate through on some of those other specialists, whether it be dermatology, ophthalmology as well too, so they can kind of see from that side, how our patients are also managed as well, so that we can be more comprehensive with our care. The second 2 years of fellowship are very research oriented, and so fellows need to complete a research project by the time that they graduate. And so your first year, you get a little bit of experience just trying to kind of figure out what you might want to do, what kind of project you want to do. And then your second and your third year, you spend a majority of your time kind of doing that research. We have the opportunities to get masters here, so if you wanted to do your master's in clinical research, that can overlap with your second 2 years of fellowship.
That is a program through a collaboration with IU School of Medicine and IUPUI, with classes on campus here that really are meant to foster understanding of clinical research and provide opportunities to apply for grants and to have a master's in their area of study when they finish their fellowship. And that's a unique opportunity.
Pediatric rheumatologists, I think, have the opportunity to really take their career kind of whichever direction they want to, if they want to be more clinical or want to be more research or somewhere in the middle. And we have physicians that do kind of all of that, so the fellows can kind of, really get a sense of what do they want to do after they complete fellowship, and I think that's good.
Our pediatric rheumatology program is very flexible in its curriculum because we have in the past really taken one fellow every 3 years. One of the very exciting things about our program is that we have a lot of support from pediatrics and now have the ability to take one fellow per year. And so we actually have an incoming fellow, and we'll have 2 fellows only for the second time in the entire time that we've had a fellowship program, and great recruiting opportunities. Our curriculum is very varied in that if a fellow wants to focus on one particular area of study, we can modulate the curriculum so that they can focus in that area. So if you come in thinking that you want to do clinical care and be a clinician educator, and then all of a sudden you find that your heart is really in bench research or translational research, we can make that change for you so that you can follow the career path that you would like to move forward with. One of the great things about Riley Hospital in general that translates well into our pediatric fellowships is that our specialists really do have a sense of collegiality and work very well together.
Because we deal with a lot of diseases that involve a lot of different organ systems in the whole body, we do rely on our other colleagues to help out manage these kids, and they definitely help us.
And so what that translates to is a really broad education for our fellows and good interaction with other subspecialists so that they have a complete complete understanding of not only why they're doing what they're doing to care for their patient, but why those other specialists need to be involved in what their role is long-term for those patients. I think one of the words that sums up one of our best values is commitment. We have commitment to one another as practitioners and colleagues. We have commitment to our learners to provide a good education and a good background for them to then use that as a springboard to go out and become independent practitioners. We have commitment to our families and our patients to take good care of them. Our fellows are integral to our teaching, and they can really take as much reign when it comes to their focus in teaching as they'd like to.
They can also get their master's in teaching, so if they want to be more primarily like a clinical educator as well too. So that's nice to have that here, and that can help advance our fellows' careers afterwards after they graduate.
I think pediatric rheumatology is a field that is absolutely fascinating for learners who are interested in multi-system disorders. There's not one disease that I can think of that only focuses in one organ system. And so you really have to pay attention to the entirety of the patient. You have to be a complete doctor to take care of them. And so if that is something that motivates you and encourages you and challenges you each day, then pediatric rheumatology is the field that you need to look at.